Good afternoon, everyone. Thank you again for being here at Your Money, Your Health. We are so invested in ensuring that you get all the information that you can when it comes to your money and your health. You've heard from Caleb from Investopedia and also Amy Morin, the editor-in-chief for Very Well Mind. I'm Dr. Jessica Shepard, the Chief Medical Officer for Very Well Health, and delighted to be here as we go into our third panel, which is really bringing in more of the healthcare perspective when we think of your money, your health. And before I start, I really wanted to remind you that we want this to be engaging. We want your questions. We want you to be able to submit those questions. And you can actually submit questions if you look at the right-hand side of your screen on the bottom. There should be a question mark icon, and that's where we're going to be able to see your questions, and we're going to be able to get to them throughout the duration of this panel. So this panel really is for the future of care from the patient perspective. You know, as a physician, that is a very important part of training, is the information that we learn. But at the end of the day, it all boils down to what is important for that patient and how do we treat that patient and what is that perspective of the patient. And we are going to see that throughout this pandemic, there has been changes to communication when we think of healthcare information, the relationships between physicians and their patients, and also healthcare payment. What does that look like for healthcare providers? What does that look like for patients? And what does the pandemic do to damaging possibly these interactions? And how can we make sure that that communication and information helps patients make better decisions for themselves in order for them to be safe and have them well-being? So I am delighted to bring in our panelists for panel 3 today, and our guests are here with us live. We can see them here when they come up on the screen. We have Dr. Jim Madara, who is the CEO and Executive Vice President of the American Medical Association, which is very near and dear to my heart because that is actually the largest physician organization in the U.S. And then we have Dr. Jim Merlino, who is the Chief Clinical Transformation Officer of Cleveland Clinic out in Ohio. And really that's combining clinical and hospital care with research and education. He's had more than 30 years of healthcare experience, and he's really focused on elevating the quality and safety of patient care. And we have Hesu Joe, who is the the clinical operations for BetterHelp, which is actually the world's largest therapy platform dedicated to making mental health care accessible, affordable, and convenient, which is ever so important during this pandemic that we address mental health and mental well-being. So welcome to all of you. Thank you for being here.
Thank you for having us.
Great being here.
Yeah, great to be here. Thank you so much.
Thank you. You know, this pandemic has really changed the human response to when we think of crisis and crisis information, how that information is distributed, delivered, and also how it's received. But particularly when we think of your money, your health, how does that impact certain communities? How does that impact hospital settings? So I'm going to start with you, Dr. Madara. During the pandemic and now, what I have seen, you know, in my physician community and hearing from all over the world, that burnout has been seen, you know, much more often due to emotional exhaustion, depersonalization, a diminished sense of personal accomplishment from work stress. How do we discuss or even address the concerns about the physical and psychological consequences for healthcare providers that have been tasked with caring for patients with COVID, and even those patients who have not been hospitalized due to COVID? What would you say about the strain in that type of healthcare setting?
Well, that's a really great and important issue, Dr. Shepard. Let me just say that when people think of physician burnout, a lot of times the approach that people think of is to increase resilience, which is a reasonable thing to do. But when you measure resilience in physicians, you find that it's very high, and it's higher than the average of other white-collar professions and the median. So the problem to really attack is not increasing resilience. It's making the environment around the physician more workable. And what kinds of things diminish that environment? Well, there's a big kind of information gap that has to be filled in, but for physicians, for them to use their time effectively. We've done studies that show the primary driver of satisfaction in a career for a physician is time with patients. And then we do other studies to see, well, how do you spend your time? That time is spent for every hour with a patient, 2 hours doing administrative work, and that was even stressed more during this pandemic. Just to give an example, in April of 2020, I was speaking to the head of an emergency department in a Brooklyn hospital. They had 15 bays in their emergency department, and they currently had 85 gurneys patients there. So it was almost an impossible situation, and it leads to a lot of burnout in the absence of support systems, including relevant, timely data access.
That's, interesting to hear, because, as a physician, many of the times that we take care of patients, we actually don't take the time to step away to see exactly what's going on in our lives in order to address the issue until sometimes it's very far into the progression of whether that's depression or anxiety. So there's so much more to it than, again, just doing more work or feeling that you need to cover up the intensity of how much you're actually doing. Which brings me to my next question. Because of that emotional exhaustion from a physician standpoint, we know now from patients, these are things that have been able to be studied over the last 18 months of how this actually impacts patients. Hasu, how would you say that you have found patients being affected? I know now when it comes to mental wellness, more than ever, we have seen patients use therapy, whether that's through telehealth or even going to their psychologist or psychiatrist or therapist. What have you seen throughout your platform?
Definitely seen a huge increase in people looking for these services. It was as recently as 2 years ago that a lot of people had a lot of resistance and pushback to the idea of teletherapy, telemedicine. And I think most providers were on the same side of the coin in terms of wanting the best care available to their patients. And I think some of the resistance comes from this idea or notion that teletherapy, telemedicine cannot replace being face to face with someone. As a healer, it feels like you need to be there in person, in the room with your patient. And, what I'm seeing now is we've all had a lot of our abilities to go out and meet a bunch of people face to face taken away from us for a variety of good reasons to protect public health, public safety, but it still leaves us isolated in our homes, stuck with whoever it is that you live with. And sometimes you need to talk to somebody else. And I think a lot of people, with all the distractions of life being taken away, some good, some bad, we have been forced to look inward, to become very introspective about different values in our life, how we want to spend our time. And I think there is an increasing demand that keeps growing for mental health services because people are realizing maybe I'm not so okay when they don't have all those distractions out there of everyday busy life. And, in that, we're seeing the same things that people have always come to therapy for: anxiety, depression, adjustment, grief. And now there's this compounding factor that all of us globally are sharing, an anxiety around whether things are going to go back to normal, or am I even going to feel safe again going grocery shopping? And this shift into bringing more focus, bringing more attention, and bringing more investment into your mental wellness and health has been something interesting to observe.
Yeah, interesting to observe would probably be what everyone could say about their experience through the last 18 months. Dr. Merlino, you really focus on the patient experience, quality and safety, and also continuous improvement in hospital systems, specifically yours at Cleveland Clinic. How has your system rather created a customized and compelling experience that both increases patient outreach and also targets the unique needs of the patient population?
Well, it's interesting. There's a lot of lessons that are going to be learned when the pandemic, we hope, is finally over. But one of the things that I think is true is healthcare found its agility during the pandemic because we've needed to respond to the needs of patients. As we've clamped down on visiting hours, as we've restricted certain access to services. We've recognized that that doesn't mean that we can't stop delivering the care. We can't stop building the human connection. So we had to find ways to adapt, and we had to do it quickly. I think it's incumbent upon us in healthcare to make sure that we never lose track of what's most important, which is the human connection. At the end of the day, we're serving people, and we're serving people in their most challenging times, their times with the most anxiety, and we can't detract from the care that we have to deliver to them. So whether we're adapting with telehealth so that we can provide care into the community where people can't get it, or whether we're providing telehealth services to patients at the bedside so they can be with their family members when they can't be in person, we have to keep in mind why we're here, which is that we're serving people. We're serving people in the worst part of their lives. We're serving people when they have incredible anxiety, and it's our responsibility to continue to be compassionate, to be empathetic when we're trying to adapt our services.
Yeah, I'm learning so much as all of you are speaking. At Very Well Health, we pride ourselves on providing accurate information, but is also very trustworthy for people who are looking for information in a time of need. So that agility and that adaptation that you were just speaking of, Dr. Molino, I have seen in so many different ways through this pandemic. But I think that all of us have an equal responsibility into how we can shape that response. For all of you, I wanted to ask you this specific question. When we look at this pandemic and really how it has shaped human response, right, to crisis information, this has been very a crisis mode for a lot of different people in various different ways. I think everyone has kind of had their collective experiences through this pandemic that has played out very differently for everybody. How do you think in the hospital setting or, in a healthcare setting that has shaped the human response to crisis information? And that's for all of you to take a stab at that.
Well, I'll kick it off and just say that there were things that we're really stressing as we've been talking about during this pandemic. But taking a step back, you look at a lot of the things that we're stressing were present before the pandemic and just amplified by the pandemic. And so we take a view of, in the mid-century, what are our pre-competitive needs that we have now? What I mean by pre-competitive is that, what needs exist that if they aren't fixed, it doesn't matter what health system we have mid-century, it's not going to work very well. And those pre-competitive needs shape our strategic thinking. And they include better thinking and around chronic disease and care for chronic disease. 100 million people now in this country have chronic disease of some sort. It accounts for 90% of the $4 trillion health care spend. And it's now probably even more with long haul and other consequences of COVID-19. We need to understand and do better in chronic disease. I mentioned before data liquidity, that, along with chronic disease, you need to have good organization of actionable data longitudinally throughout patients, the interaction with the healthcare system. A third is training the physician workforce for the 21st, not the 20th century anymore. A third pillar in medical education, health system science, and talks about team-based work, the knowledge and cultural competency that physicians need to deal with our diverse population, the data analytics that are needed. Another example is sort of getting rid of the needless regulatory work and the kind of work that allows physicians to only spend an hour out of 3 face-to-face with the patients when both physicians and patients put that time together. And then lastly, this was really pointed out in detail by the pandemic, is to root out racism, both inside the halls of medicine and medical care and outside. We aspire to high quality care and safety, but if we have populations that have very different kinds of health inequities, that's a glass ceiling on how well we can do as a nation in our healthcare. So I think these 5 or 6 things are pre-competitive needs that pointed out by the pandemic, pre-existed before the pandemic. And if we don't fix these, no matter what health system we have, it's not going to work as well as it should for patients.
I think that is so important that you mentioned that that unless we really pay attention to and fix those things, it really doesn't matter what type of healthcare system that we have. Jesu, what would you say is that disconnect throughout these last 18 months that you found have maybe 3 tips that you could give to help reestablish the connection with people when we think of emotional connectivity and mental well-being?
Great question. I think a lot of us have had a diminished and some folks even an eliminated access to connection with other people face to face. I will say that technology has allowed us to connect with others in such a meaningful way, piggybacking off of something Dr. Madera said about regulations and how this, I think, holds back providers from doing what we were meant to do, which is to provide help, to provide services. And we're seeing it in the mental health space too, with really state licenses. Even though we have the technology in front of us, we are barred from making matches for clients and therapists because of not being licensed in the right state. So, bringing it back to your question of how to maintain connection, how to continue to achieve emotional wellness when it comes to context of being with other people, use technology. If it's not safe for you and if it doesn't make sense for you to get into big groups, to connect with other people, to create meaningful experiences and memories in person, we have this thing right in front of us that allows us to connect. And if people are thinking, I can't really replace a face-to-face interaction through something on my smartphone or on my computer, it's not as personable, it doesn't seem like real life, I'm going to tell you now, people are finding their spouses, their life partners online. People are making huge decisions like closing on a house, going into escrow, all doing it digitally, never coming face-to-face with a broker, any kind of real estate agent. We are educating our children. We're trusting that our educators are going to be able to effectively teach our kids how to read, how to do math. So really tune into what you have as access for technology. And, technology, there's double-edged sword here. I think it allows us to connect. It allows us to create community. It allows us to organize. But it also can be responsible for the spreading of misinformation. It can also be used to create a vacuum of knowledge in which people can reject ideas that don't line up with their own beliefs. So it's being mindful, as always, of being in tune with what's available to you, what you have access to, and making it work for you in a meaningful way. And I think we can continue to do that with other people, even if we can't see each other.
Thank you. I really appreciate that because even in this vacuum that we've all been in, where we really maybe interact with our screen more than we ever have before in our lives, it really is taking that step back to ensure that we are utilizing it to the best of our abilities, but also that we are finding a way to connect the way that we do best individually. And I think that we are getting a little bit closer to that balance of balancing the two, of still getting everything that we need to get done, but still finding ways to connect. Dr. Molino, I know, health literacy is one of the things that can impact a patient's experience, how they receive information, how they're able to actually translate that information, which is, again, something that you really focus on. The disconnect in health literacy with patients is something that also has heightened over this pandemic. What do you think are some strategies to build a commitment to health literacy or improving health literacy with patients, but also with providers and their patients?
Yeah, I think we are still seeing the effects of a general problem in health literacy during the pandemic that we knew existed before the pandemic. And that is that it's not something that we train providers to understand how to improve. It's not something that we train other healthcare professionals to really focus on. We often produce medical information that is not health literate. So all of that kind of challenge and opportunity that existed before the pandemic was magnified now during the pandemic. What you see happening out there in the market or in the healthcare world is this incredible flush of disinformation about healthcare, particularly about the pandemic, about vaccinations. And so that has just compounded the problem. What I think we've needed to do, and we need to do more of, is be very specific about what we're communicating. So if you think about the pandemic, there's tremendous confusion about the virus, about the variants. There's confusion and misinformation about vaccine. I think healthcare providers, businesses, our governmental institutions need to be aligned in the messaging about the disease, about the response to the disease, about the treatment, about the statistics. I think that we all have a responsibility to make sure that we're tamping down on anything that exploits sensationalism about this disease. And I think we all have a responsibility to communicate very clearly, very simply, and repeatedly about what's important that people need to know about how to take care of themselves, how to protect themselves, about the treatments and the vaccines that are available. We all have a responsibility for that, and we have to be very thoughtful about how we're communicating to the public, how we're communicating to patients, and also our caregivers. At the end of the day, we are still in the middle of this incredible health challenge that we've not seen in a generation. And we have to do more to take control of the narrative so that we can use that as a tool to help defeat it.
I think, like you said, misinformation is abundant nowadays, and we really have each of a responsibility to make sure, again, that information, that dissemination of information, and also evidence-based medicine is really given to the population and the public, because the more that we are consistent with that messaging, and the more that we are very sure about the information that we're putting out there, we will eventually get to a place where, again, that will rise, and that's understanding what people will take from that message and how they'll actually utilize it in their health, in their families, in their individual care. Going now more towards what we look as far as the future of care. This panel is focused on the future of care from the patient perspective. Now that we have seen us go through something that we, again, you said, Dr. Molino, have not seen in a generation, and looking at the emotional impact that it has on our society, looking at the actual future of care from the patient perspective, what would you say is maybe one or two things that, in your opinion, was what we would need to focus on in order to increase or heighten that patient perspective and that experience when we're talking about actually the future of care?
Well, I think first of all, we should be optimistic about the future of care, and we've learned some lessons, or are learning lessons in the pandemic. Number one, our caregivers, regardless of their profession, nurses, physicians, are incredibly resilient, and that should give us comfort that our people are out there every day on the front lines taking care of really sick people as we manage this. Secondly, I think it's that innovation is alive and well, and if anything, I think innovation has been accelerated during the pandemic. We are doing things that we didn't think were possible. And you're seeing it in the outcomes of COVID patients, not just because we have some treatments that are marginally effective against the disease, but because we adapted very quickly to what we were seeing out in our hospitals relative to how to take care of our really sick patients with COVID. So I think relative to the future, we should be optimistic. I think our caregivers are resilient. They come to work every single day. They put themselves in personal jeopardy to do what's right to take care of people. And number two, despite the pandemic, we have kept people safe. We've delivered high quality medicine, and we have innovated to meet the challenge of what we've needed to do. I think our next challenge is to just finish the job, to defeat this pandemic, get people vaccinated, have people stay safe, so that we can get on with our lives.
Dr. Madara?
This makes me think of a study that was fortuitously done and released in late October of 2019, just before the pandemic. And this was the global assessment of pandemic risk done by out of the Bloomberg School at Johns Hopkins. They looked at 195 countries with 40-some criteria, and they concluded that the United States was best positioned to weather a pandemic, and yet it turned out not to be that way at all. And if you look at where did well with those 40 or so questions, we did well in science and public health and laboratory medicine, epidemiology. So if you look at out of those 40 or so, where we didn't do well, it was access, socioeconomic resilience, the split between wealthy and poor in this country, the culture of vaccination in this country as well, and then also some political risk to our system. And when we look at this overall, we realize that those four things that we scored poorly on is really what dinged us during this pandemic. And if we don't have better access, if we don't have more equity, if we don't try to fix the vaccination resistance issue, and that in part, I think, relates to the communications that we were talking about. And in that communications area, I would say a couple of things that we could have improved on, I would think, is to have reliable sources of information for the public that are coming out of government agencies and our physicians or scientists. As soon as a politician, regardless, independent, Republican, Democrat, in a divided nation like ours, starts talking about the science and giving an opinion, it politicizes the science. So that's one thing I think we could have done much better on. Another thing is we could have done phraseology a little better. So not everyone is familiar with how science is done and the trial and error and whatnot. And you kind of lose sight of that with a novel virus where you're learning every month something different and you're surprised every 6 weeks of something new. And so rather than saying, this is what one should do, one needs to say, we're in a novel circumstance. We have incomplete knowledge. We're gaining knowledge every day. But based on the knowledge we have, we think this is what should be done currently. To portray an idea that this is a sort of a living, breathing new thing, and it will wax and wane, and we'll have to wax and wane with it. Because when a community thinks about its disease burden, not as going up and down, but just the suggestion that 1 month you have to have masks inside and another month you don't, it can be confusing not to recognize that this is derivative from the scientific learning that we're going through.
No, I really appreciate that perspective and that answer. Hasu, for you, when we look at the future of the patient perspective, what would you say would heighten that or improve that experience for patients and from their perspective when we think of healthcare?
Tough acts to follow, I gotta say. But I think I'm going to turn to technology again. I think people should see this as a really viable option, especially if they haven't really considered being able to get proper health care through their phone. Like I said, it wasn't that long ago that most people thought it was a weird idea. I think a lot of people in the field even thought it wasn't going to be around for very long, but that has certainly changed in the past year and a half or so. Telemedicine has made it so that people can continue to access care. It also has the side effect of leaving some spaces in urgent care and ERs for folks that really need to see somebody in person. I think it's also important for all of us in every system and every nook and cranny of healthcare to think about the work-life balance and the way that morale is shaping for the providers themselves. I feel like I could go on and on about this. I also agree that there needs to be equity in the world of healthcare. There's so many issues, especially in this country, when it comes to access to this healthcare because of cost, because of absence of transportation, because of health literacy, as you mentioned. There's demands and significant needs for changes, I think, not just in this space, but at the government level too. I'm not quite sure how health and scientific knowledge has become politicized, or why we are now saying that if you believe in this, and that means you probably voted this way. Like, I'm not quite sure where this came from, but I think if our future is to be optimistic about having everybody adopt healthy lifestyle, we somehow have to acknowledge that healthcare, I mean, our bodies and our health, our mental wellness and our physiology, it's not connected to our political alignment. And all of us are so much more similar when we think about ourselves in a medical way. And I think it's really important for many people to be focusing on those similarities rather than the differences in ideology.
Absolutely. I think we absolutely are more similar in our experiences and our biologic makeup than we can even imagine. And so, even the fundamental thought of that can a lot of time take away all of the distraction when we think of healthcare and those who do not get healthcare, why that is. We do have questions that are trickling in. I'm excited to add this first one, and any one of you that feel you want to answer this, that's fine. If it's all of you, one of you, and I can even chime in as well. But a question that we had that came in is, what resources and suggestions do you have for friends and family who are caregivers to loved ones during this pandemic? They are often isolated and are handling a broad range of medical mental health issues without support. So the question again is going to suggestions for family and friends who are caregivers to loved ones during this pandemic.
I mean, I will say that what you're describing is compassion fatigue. So, folks that have this question and you're not familiar with this term, just knowing this language will help you search for the resources that are local to you. And if that means therapy, and if you have a barrier to access because of cost, if you're in America, you can call 211 on your phone, and this will provide you with a phone call with somebody that will be able to link you up with local resources that are available to you, often subsidized by your county or your state government. So I really encourage folks to look at what's available to them locally, since eventually we'll all be able to see each other in person, optimistically.
Dr. Molino, I'm going to pick on you a little bit because I know with what you do, enhancing that patient experience, what would you say, in the hospital setting where you see patients come in and out from being admitted and readmitted possibly, what would you say to family and friends who are their caregivers?
I think we have to reassure people that we will get through this. I think Ishu's point about compassion fatigue is really important. It doesn't just affect professionals taking care of patients. It's affecting families. It's affecting societies. I mean, we're in our fourth surge right now. And, the first time around, we were all frightened. The fourth time around, we're not frightened. We know what to do, but it's very fatiguing. And I think when you look at the history again on COVID, the impact, the psychological impact, not only on healthcare workers, but on our population in terms of the magnitude is just going to be indescribable. What we have to be sensitive to is be mindful of what we're dealing with, be mindful of the stress that people are under, and frankly, look out for each other. We have to retract to just basic needs of making sure that we're providing companionship, that we're providing, compassion, that we're listening to people. We don't need to be healthcare professionals to do that. We just have to be open-minded and mindful as to what's going on around us to make sure that we're supporting each other. Now more than ever is the time when we need to come together and make sure that we're paying attention to our friends, our families, our neighbors, to make sure that we're supporting them because this is tough and it's not over yet. And we want to make sure that we're there for people.
Yeah, and I also think that, with the information that people are hearing, again, we've unfortunately politicized it, and also, where we get our information does play a part in how we process that and how we make decisions. I think shared decision making is also a very big part of the patient perspective, is how they make decisions and where they get that information from. Now, when we think of shared decision making and practice in general healthcare, it really does increase the consumer, the patient's knowledge about the specific issue, but also it provides more comfort for them when we think of them actually then having to make a certain decision. Many decisions have had to been made during these last 18 months for people who have been put in positions with themselves individually, or a lot of times family members that have been ill. And again, maybe some have that passed from COVID-19. So shared decision making is a very big part of that experience. When you think of the collective nature between the patient and the physician or the healthcare provider in making decisions, where do you think we can make improvements in shared decision making?
I'll take that one. Oh,
Go ahead.
go ahead. Go ahead. I was just going to say that I think that, again, it's something that we haven't really focused on traditionally. But when you look at the evidence on shared medical appointments, when you look at the evidence on bedside shift report out with nurses, when you look at the evidence on plan of care visits with nurses, physicians, and patients and their families, outcomes improve when those activities are performed. And so it's really our responsibility to broaden the number of people that are involved in the discussions with medical outcomes. I think that if you're a physician and you're having conversations with a patient, family members aren't present, we should make an effort to include family members. If we're nurses and we're having conversations at the bedside or in the office, we should do everything we can to broaden the circle of people, because not only is understanding increased, but remembering is increased, and it gives people the ability to engage in a much more meaningful way with the decisions that they're making to impact their outcomes and health.
Dr. Madera.
Yeah, I would just make 2 points. First of all, I agree with all of that. I would say you have to craft it a little bit for the individual, though. My as an example, my sister is someone who wants to participate in this conversation. When I go in and my physician talks to me about something going to be done with my health and gives me alternatives, I'll say, well, this is why I come to you as a doctor will. I want you to decide. So it varies a little bit with the individual as does everything. The second point, which is stepping back from this a bit, is thinking about how we as a country, as a medical profession, think about outcomes. So, it's if one has a knee replaced, one can talk about so many degrees of deflection, that how you bend that knee, and that's our outcome. But from the patient's point of view, that's not the outcome that's important. The outcome that's important is, can I walk stairs? Can I cook for myself? Can I take care of my grandchildren? Can I go to work? And so a shift to these more patient-reported outcomes, I think, would be a healthy shift for us all, because after all, that's what 320 million Americans think that we're paying $4 trillion for.
Mm-hmm. Absolutely. And even when we think of those decisions that are made, research has actually shown the less that you have your family members or people who are there in order to help make a decision, or that shared decision making, it actually can worsen health outcomes. And it's surprising that, we're speaking of this when we were just during a pandemic where many times family members were not even allowed in the hospital, in the rooms with their loved one. And so again, decisions were having to be made without having the people that can help them translate the information or help them make that decision making when it comes down to something that can be a life or death situation. And that too can impact why we have seen so much mortality and morbidity throughout the pandemic, is again because there was no connection, no shared decision making. As we're kind of closing towards the end of our panel, I really wanted to ask another question that's come in. If someone is looking for a new healthcare provider, what questions should they ask their physician, their nurse practitioner, their PA, to make sure that they're a good fit? And also, this actually pertains to mental wellness providers as well, your therapists, your psychologists, and psychiatrists, that they will actually find a good fit and the level of care that they want or need is being met. What should they be mindful of?
Well, I think
would
one
just
thing
say-
is, yeah, go ahead, Dr. Madera.
No, please.
No, you go ahead. You let me go last time.
Well, I would say one thing is the the sense of folks they know in their own community in terms of personal fits. And then one thing to stay away from is whether it's to interview a physician for your care or just to get a second opinion. If a physician doesn't want to engage that, it's not the right physician for you.
Yeah, I agree. And I would add, there's a lot of ways that the public can get information on physicians and even hospitals, and you should take advantage of those resources and make sure they're reputable, and pay close attention to the ones that are from societies and organizations that represent the medical community. But I don't think it's necessarily about the questions that the patient can ask. I think it's about the questions that the provider asks. And what I would want to know for myself or a family member is, are they taking an interest in really understanding what my needs are and what's important to me? And I think Dr. Madera touched on this a little bit with patient-reported outcomes, right? Because I can get information on a surgeon's infection rates and their mortality and their morbidity. But what I really want to know is, are they going to spend time with me? Are they going to understand me? Are they going to treat me with kindness, empathy, and respect? Because that, to me, says they're going to go the extra mile in making sure that not only are my needs met, but they're going to connect with me and treat me like I'm a family member, which I think will allow us to have a better relationship.
That's great. From your perspective, I was going to actually just ask you, I was just about to get to you. Being on an online platform, what do you think are the best way for people to, I guess, vet their experience or figure out from an online perspective and telehealth perspective, what's going to work best for them? What are some tips?
I think a lot of what's already been said is applicable also. You want to feel safe with this person, that you're expected to dive into your deep, dark thoughts and some emotional, thought processes that you haven't even admitted to yourself. So it's important that when you are with this person, the feeling of safety is present in the room or in your home, wherever you are. And, with the online experience, similar to what Dr. Molino said, all of these therapists' license information is made available to the client, the patient, consumer, whatever you want to call them. And I think it's important for folks that are interested in making sure they want to vet these professionals on their own to know that license verification sites are now digital. They're all accessible to the public. And we have a right, and we have, I think, a responsibility to ourselves to look into the professionals that we're matched with. You can look into whether there's any disciplinary action on their license or any open investigations if these things are important to you. If you find that stuff, it's also worth it to ask these things to your provider if you're thinking that you want to keep working with them, but you have some concerns. If somebody is resistant or not wanting to answer your questions, I think that's a pretty good sign to move on, which was already mentioned as well. And with a therapist, of course, what questions they ask you is going to be quite important, and it's going to help you feel like this person wants to know who I am. This person is asking the questions that are surrounding my presenting issue that I brought to them. The thing with online therapy, and some providers are not okay with this right now, but at the end of the day, we're thinking about the patient. And in online therapy, we've made it very easy for them to change providers just by clicking a few buttons. And this is because we want to make sure that people feel like they are in the right situation for them. And we want to make it more of a seamless process than what people might be used to in offline, having to go through their insurance panels or seeing who has open availability. So I think especially with the online therapy space, there's so many tools and so many features and so much innovation going on to make sure the member has full access and full control over their own care.
I am so delighted to have had all of you on this panel today. I myself know that I've learned so much from us being flexible and having the ability to adjust to what we've been through over the last 18 months, to also being optimistic. I think, even in the depths of despair that some of us may have felt through this time, we also have to be optimistic. And also our mental wellness. Our mental wellness is such an important part of our overall health that sometimes that is actually impacting our physical health or the ability for us to recover or restore or heal. So I wanted to thank you all for being a part of this panel, which is the future of care from the patient perspective. And again, as couriers of healthcare information, all of us have a responsibility to ensure that we help patients make better decisions, that they feel safe, and that their well-being is taken care of, because that is, again, of the utmost importance at the end of the day. So thank you to all of you for taking your time to educate, to advocate, and also discuss these important issues today on this panel.
Great fun. Thank you.
Yes, thank you very much.